Today we're going to talk about an article that just came out about swimming and back pain. It looked at swimming as a possible intervention for back pain and also looking at swimming as a way to prevent back pain occurrences. Well, it's published in Musculoskeletal Science and Practice, and the authors are out of Australia. And as I mentioned in the introduction, we're looking at swimming because it's a possible way to get people healthy while they're dealing with the back pain, stay active, maybe reduce some loads on the spine by being in the water, and also getting blood flow, other general exercise benefits for people in pain, and seeing if swimming maybe is more tolerable than other exercises and allow them to help overcome their episode of pain. So one of the things they mentioned in the introduction that I slightly disagree with is that swimming, they say, is relatively low cost and easily accessible. And I think that's kind of true. So some people might have access to a pool and are able to swim, but majority of people I don't think can. So some research says that only maybe 50% of people can swim in the United States. Maybe that's a little higher in certain areas. And then of those 50%, how many people actually have swim access? How many people have a pool or a beach somewhere where they can regularly exercise? And I think that's one of the most important things to look at is what is the most likely thing that they can do regularly. Is swimming going to be that thing? If they don't have pool access, probably not. So through this article, the main findings really were that they couldn't say that swimming was either preventative or helpful for people with back pain. Not saying that it isn't, they just couldn't really find that it was that helpful or better than any other interventions. So then what does that leave for us to tell our patients? So let's talk a little bit about that. So from this article, how do we see that affect what we or inform what we do in our practice? So one of the ways this shows up for us is someone will come into the office and say, "Hey, I have this friend, and I don't know what to do for my back pain, but they said swimming really helped them. Do you think I should swim?" So based on the evidence, we can't say strongly that swimming's better than anything else, but we do think that exercise could be helpful for people. So that leads us to our conversation we're going to have with them. As I mentioned before, not everybody has access to a pool or can swim effectively. So we kind of fall back on the common sense with someone. So with our interaction with the patient, we think it's super important to figure out one on one with them what are their barriers to exercise because of their pain and what are their barriers to exercise from other factors: time, money, enjoyment. And from there, that's going to help us inform what exercise recommendations we can make and how we can support them to actually achieve the exercise outcomes we're looking for, which is baseline 150 minutes a week and strength training a couple times a week as well. That's just World Health Organization standards. So if swimming can be part of that for them, that's great. But the conversation typically goes, you know, yeah, your friend swims, that's great for them. I'm glad it helped their back pain. I can't say for sure it's going to help your back pain, but do you like swimming? Are you into swimming? Do you have pool access? If those answers are yes, then yes, swimming could be a viable option. And we'll talk to people what that could look like for them. If they've been swimming recently, we might help them develop a plan to progress their swimming or at least have a safe starting point for swimming. If they haven't swam in a long time, we might just have them be getting in the pool and doing water aerobics or very low level swimming for laps. But I think the most important thing is having the conversation with the patient to see if this is actually going to be something they can do. Again, I think there are some barriers to entry for swimming, so maybe walking has the least barriers for entry out of any exercise that most people can do, and a lot of benefits. So again, it just comes down to a frank conversation. If swimming is something they can do regularly, I think it's worthwhile to try as part of their plan. When they are swimming, we want to see that they can tolerate it well. So they might have a little pain during, that's fine, but it shouldn't significantly spike during or after for the next day or two. And then we want to see them be consistent with it again, trying to get up to that 150 minutes per week. That could be all swimming, it could be a mix of swimming and other things. And we'll see. Hopefully, from there, we can progress into other things. Hopefully, that'll help their back pain come down and be part of the equation. But again, it's patient specific. Swimming might be for you, might not be for you. And that's going to be the biggest thing that determines whether we recommend it or not. If you have any questions about swimming and back pain, feel free to put some comments down below, and we'll get back to you as soon as we can.